Hey guys, happy Sunday. Vlad here. Hope you can hear me well and not too much echo. I think I'll definitely will start making some studio arrangements. So thanks for tuning in. I know people will jump on in a moment or so, but I thought I'm just gonna start anyway because it will be recorded and will be posted. So I don't want to take time giving people opportunity to join. I'll just start speaking, and as people join, they can definitely participate in the conversation. I definitely encourage contributions on all the viewpoints, whether you agree with what I've been sharing this whole week or not. It is Sunday. It is Easter for Orthodox Christians, so I consider myself to be part of that, part of religious beliefs or so. I definitely don't go to church every day or whatnot, but happy Easter to everybody. And I am wearing Ottawa Senators t-shirt for a reason. I looked for my closet just more or less to have something aligned with what I have to say. The reason why the t-shirt, for example, is to me, this shirt has nothing to do with hockey, actually. I mean, I follow a little bit, but not necessarily that much. But it really represents for me the warrior, the defender. Ottawa is obviously the capital of Canada and where the government sits and makes decisions for the whole country and 37 million people that live in the country. That's why I'm wearing this t-shirt to represent the mindset and perspective that I have. Few things that I want to discuss today. The first one would be is I actually thinking that this is definitely going to be ongoing process with me sharing what I believe to be true, and it's definitely something I believe is important. I mean, a lot of people jump at me saying like, why do we have to follow your lead or instructions or suggestions? We have officials that saying certain things and most of things that you're saying is in direct opposite. And to me, that's actually a good question to ponder. Why is it someone like myself that saying things that I'm saying, and the people that's supposed to be in the public health and supposed to be taking care of the health of people, they're not saying the things that I'm saying. The best example that I can make is the health officers of Canada and health ministers and in all the levels of the government. I really spent the last, hey Mina, how's it going, brother? Thank you for everybody that's joining. So the last 4 weeks of this lockdown definitely gave me an opportunity to watch all the briefings from federal, from provincial, from municipal government. I live in Toronto myself, and I also, on top of that, listen to the to ministers' briefings and whatnot. I definitely listen to only Ontario province. I have not listened to anyone except British Columbia health minister briefing today, and just a couple here in between. But the federal, I listened to complete Trudeau briefings. The Ontario provincial government, Doug Ford, with all the ministers he would have at whatever date, I listened to all of them. And the municipal one, the Toronto mayor with Dr. Davilo, the chief medical officer for Toronto, I listened to all of them in the last 4 weeks, and the things that I would hear just would be alarming to me, would be shocking to me. And it's something that, like, why are you saying the things that you're saying and you're not saying the things that just make sense to help people stay healthy? So I don't want to ramble too much. I didn't script my talk. I really want to talk from the heart more than anything, and share my concerns and share my real thing that I have that I believe to be true. And I mean, the first thing that I want to discuss, I guess, is people say like we have the World Health Organization that declared the pandemic, and also gave guidelines, gave one type of guidelines in the beginning of the year, and they completely changed the guidelines afterwards. And they just justifying it that, oh, wow, we didn't know what was going on, and we allowed to change our minds. Well, that possibly can be the case for sure, but I'm just going to make a couple of points to question that statement. First of all, the person that's leading the World Health Organization, Tedros Adhanom, I'm going to read this actually. So Tedros is an Ethiopian microbiologist and internationally recognized malaria researcher who has served since 2017 as the Director General of World Health Organization. And Tedros is the first non-physician in this role. So that would be the fact that the person that's in charge of the world health is not a physician. So that person, again, I honestly, guys, it's a lot of information to try to digest in between making posts and then answering to hundreds and hundreds of comments from people. And again, I'm privileged to be in a place where I do have that influence. And trust me, I do not take it lightly having the influence, 3,500 people on Facebook, and I know the algorithms, I don't know, 10% maybe see what I post. But still, even 10% sees that I post, that's still 350 people. And I don't take it lightly having an influence on 350 people, let alone 15 million in Ontario, 37 million in the whole Canada. I do not take it lightly at all. So for me, anything that I share on Facebook, I do my best with limited time that I have in between my life. Surely everyone has life, to check the information that I'm sharing, to actually think about it, to see if it's making sense, what's been said in the information, and then I share it. So what I'm trying to get to, first point that I want to discuss, is the person that's in charge of the World Health is not a physician. So again, I haven't done research on him specifically, besides only two things that I want to say. One is that point. So for me, that means that person never treated personally anyone who was not well, in terms of being as a doctor, in terms of understanding the diagnosis of a specific person, having experience working with hundreds or if not thousands of people in terms of medical physician, and he's in charge of the health of the whole world and actually saying what's supposed to be happening. The second thing that I have not validated, but I've heard on separate sources conversation, that when this person, the director of World Health Organization, was in charge at whatever position he was of Ethiopian health system in his country, they had an outbreak of cholera. And supposedly he actually was covering that up. Now, again, I haven't checked this. I will definitely look into that. But to me, that's two things that are already going to question if I'm going to take what this person says for the whole world to be 100% true, to be something that I should take for granted and don't even think about it. And the third point that I want to make, like, there's all these now allegations how much ties he actually has to China. And if this virus, which has now been actually proven by the Nobel laureate from France, a doctor, that this virus, according to him, this virus was actually made in a laboratory in China. So it didn't come from some bat soup, according to the Nobel laureate, a French professor. So I really don't think it's a coincidence, or it's just should be taken lightly, that a World Health Organization director and the whole organization as a whole has ties to China. The virus was created in China, and they followed the certain regulations at first in January, didn't warn a signal for people to be alerted about it. So they allowed the virus to spread around the whole world from China. And then they changed the regulations and declared it to be a pandemic. And then they basically, I don't want to say forced, but they heavily influenced majority of the governments around the world to lock people in their homes. Now, let me put it this way. You have a virus, which is real. I really want to establish. I do not dismiss coronavirus being fake. 100% not. I'm not stupid, okay? The virus is real. the virus spreads similar to flu. That's why a lot of people comparing it to flu. It's a different virus, okay? However, it's not a new virus. We had coronaviruses before. It's a different level of the virus, variation of a virus, mutation of a virus. And on the same topic, not to worry too much from what I'm trying to make as a point, even the virus that was in China, guess what? It already most likely mutated and it was a different virus in Italy. And that virus most likely mutated and it was a different virus in Canada. And that virus most likely mutated and a different virus in New York and all other places around the world. So that can be one of the reasons why the amount of cases and the mortality rate from virus around the world is so diverse. And it can be very high in the country that has a lockdown as well as not. And it can be very low in a country that doesn't have it or have it and vice versa. So that's something already to think about it. So when you have a virus that's been created in China, which again is proven by the French Nobel laureate from 2008, he's the one, the prize was for discovery of HIV. Not that he discovered it in 2008, but that's when he gets the Nobel laureate for that. So that's when the virus got created. The Chinese government supposedly can influence the World Health Organization, and that's the point I want to try to make. So think about this scenario. Just think about it, guys. Let's just stay curious. You have a real virus that's been created and then allowed to spread around the world because the World Health Organization at first made a point that it's not serious at all. Don't worry about it. No, nothing like that. But it's like flu. It spreads similar to flu. The same populations at risk like with flu. Most people are in the elderly population and with compromised immune system. Okay, so you allow a virus to spread in January or probably even before, and then you make a new statement to declare the pandemic, and now you're forcing the governments to lock people at home. Think about this as a really good point to think about. If you have a lot of people already contracted the virus, and now they're sitting at home, guess what's happening with people that when they sit at home? The immune system is getting suppressed. When you sit at home, you most likely, like 100%, I would say 99, you're less active. Even if you're going for a walk, possibly, however, I doubt how many people actually going for a walk with constant bombardment from the media and the government that stay at home. Like every time I put a radio, it's like the same non-stop broken record, stay at home, don't go out. Like I can think through those statements and still make a choice to go out and breathe the fresh air. But I know there's a lot of people that don't do that. So think about this. You have a new doctrine that forcing people to stay at home and the immune system is getting suppressed. Why immune system is getting suppressed when you sit at home? You're less active, 100%. Like whatever you want to say, you can work out at home. How many people do? Everyone went online. All the personal trainers I know, there's definitely no lack of resources to train online. People were not that active even before. Now they're even less active. So when you're less active, your immune system is getting suppressed. You're sitting inside and you're breathing one of the most polluted airs that possible is actually indoors. Did you guys know that the highest level of pollution from all the things that can address negatively your health is actually inside of the house because it's recycled air, especially if people barely open the windows and they drink they breathe in recycled air from air conditioner or whatever. Like that's so much polluted in terms of different microbes and everything that can affect your health. So you have people that immune system getting suppressed when the virus supposedly already spread out. So to me, that's already alarming. Okay, guys? Now, the other thing that I want to address is you have someone who's leading health officer in Canada, Dr. Tam, that actually is on the board of the World Health Organization, guys. If you didn't know that, she is. She's one of the 7 people or whatever on that list of people. So if she's actually getting some information from World Health Organization that's actually can be incorrect or can influence negatively the outcome, how this virus got spread and how many people getting affected, then that's something even just to think about or question. Like, we really need to question that aspect. And then you have the whole media of people that telling you that the only thing that's happening is how many cases are going on, how many people are dying, and that's unfortunate. However, the main thing to understand is there a lot of people are recovering. 96 to 98% are mild cases. What does it mean? Out of 100 people that get affected by this virus, only 4 will be serious. And considering how much medical attention they can get, they can obviously recover in a hospital or not and possibly die. However, it's also very controversial to think that if you have actual virus in your system, you died from that virus. Again, I haven't opportunity to check this 100%, but how many countries besides Sweden actually distinguish between people who died with the virus or died from the virus? You do guys understand that it's not the same thing, that you can have a virus in your system and you can definitely die from an array of other conditions, the heart disease, the cancer, the pneumonia, so many things, complications that can happen. And that's just something to think about it. So when people talk to me, it's like, why I bring Sweden all the time as an example? Well, first of all, I would really think that Sweden and Canada is probably one of the closest examples I can make in terms of social economical structure, in terms of how people live their lifestyle. I definitely don't think I can compare Canada to New York. And to me, that's very troubling that the government officials constantly try to create a fear in the public comparing Canada and Toronto to New York, which is not. It's not. We are a healthier population than New York, for sure. I've been to New York many times. The amount of overweight people, the amount of smokers over there, it's very concerning. So to me, it's not necessarily surprising, besides the possible mutation of the virus that is there. That's why so many people are dying. Plus, how many people dying again from many other things. And it's actually not the virus that caused it, but all the other conditions that were not addressed for those people. It's really amazing. So the main point that I want to make is, in terms of Sweden, is if the country with 0 lockdown, after over 2 months of the virus being spread in Europe, actually, if the virus was as contagious and deadly as we ought to believe by the government, we're made to believe by the media, is I would really think the whole country would be engulfed by this right now. And a lot of my friends make a comment, and that's a valid comment, that if you look per million people, the death rate of 1,500 in a country of 10 million and 1,400 in a country of 37 million like Canada, statistically wise, you will definitely have more people dying in Sweden than you dying in Canada. And that's why the measures that the Canadian government has taken is correct. I don't think so. The other point that I've been making for the last several days is that the majority of people that are dying in Canada and around the world, but let's talk about Canada, let's just stick to Canada, are people already who are isolated. They are either in long-term care homes or they're in prisons. Now, as a side note, just think about it. You don't need to have a medical degree. You don't need to be a professor. If you do some basic education yourself online, you can figure it out. Where does the virus actually live the longest? Does the virus actually survive the longest in a closed environment or outside in the fresh air? Interesting. So if the virus actually doesn't have as much ability to survive outside in the fresh air, wouldn't it be smart for the government to protect the health of the people, to encourage people to go outside responsibly 100%, keeping the distance 100%? If you actually have the virus and you you have a high risk of exposing population, stay at home. I get it. However, the people that needs to go outside and breathe the fresh air, and you know, and people tell me, well, you can go outside and supposedly don't know you have a virus. Well, guess what? You go outside and the fresh air, the virus doesn't survive as well as it does in a closed environment. So actually, if you do have a virus and you sit at home, even with no symptoms, guess how much more chances do you have to develop that virus into more symptoms and to more adverse effects? Well, when you sit at home. Is that possible to have as a hypothesis that that's actually can be happening? Now, the main thing that I want to also say is that, again, I'm just doing my best, watching all the briefings. It's like a full-time job. And I do listen to the politicians, and I do listen to the things that they say. And to me, it's concerning. Like I said in my life, I think I did mention that the first one that I did. This week, the Trudeau was saying every single day, except yesterday and today, whatever, that there's no new normal until we have a vaccine. And it's literally word for word what Bill Gates is saying, that there is no new normal until we have a vaccine. And yesterday, Doug Ford, Ontario Prime Minister, says exactly the same thing. There is no new normal until we have a vaccine. I'm sorry, that's definitely not acceptable. Again, if you want to create a vaccine and if you want to have it as a possible solution, no problem. I don't have a personal problem other people using a flu shot. I definitely do not. I never did. I live in Canada for 20 years. I shared my story before. I have 2 OHIP cards that I had, that one is expired and I didn't even get it. The first one I got after the first 11 years living here. Like, I don't use the healthcare system because to me, unfortunately, the Western system, I call it a sick system, sick care system. It's not a healthcare system. When the only thing that the doctors do in the Western world is dealing when you're sick, it cannot be called a healthcare system. And I've been living in Canada again for 20 years, and besides sharing a few articles about healthy living or whatever, I think most of you guys can agree that I've been relatively quiet in terms of my complete disgust with so-called healthcare system in Canada. Let's again just stick to Canada. I'm not even going to talk about the United States. It's not a healthcare. It's a sick care system. So think about this. If it's a sick care system, how can you possibly take advice and implement it if you want to be healthy? Like, it just doesn't make any sense. Like, how can you possibly take advice from someone that doesn't look healthy, doesn't live a healthy lifestyle, and then I'm supposed to take it too? Now, again, every person can have their choice. If you choose to get a flu shot every year, that's fine. Again, we live in a free country. That's amazing. But to have something that's mandatory, it's unacceptable like that. Now, right away, people want to put me in a box. I'm an anti-vax or whatever. I had my vaccines when I was a child in Soviet Union. So, and my son got basic vaccination. However, 100% I'm against my son getting a flu shot. I mean, he's eating avocados since he's a baby. He eats berries. Like, I take him to the China parks with me. Like, I make sure he's active and healthy. And like, I don't know, my lifestyle, is it gonna make me live till forever? No, of course not. But the quality of my life is the best it can be. And there's natural things that I can do to prevent from being sick and using hospitals. So that's what I choose to do. And if you choose otherwise, fine. But when other people want everyone to just blindly follow the direction, that makes no sense. The directions do not make sense when the virus is not as deadly and contagious as we made to believe. And there are other countries, rather than only Sweden, that actually follow no lockdown policy. But I don't even share them because people are going to start questioning the data and whatever. at least with Sweden, people don't question too much that the numbers are rigged. But right next to like a whole other European country, you have a Belarus that has zero lockdown. Okay, and I don't see constant even social media posts from people from Belarus that they have dead people falling on the streets. It's just not happening. Now, are people getting affected by virus? Yes, but it's not as deadly, it's not as contagious as we make to believe. However, I share on my stories just before coming on here, like, and again, I'm gonna start doing research, guys, and I really need your help. I think that's definitely something that I want to bring that up. Today's conversation is that I need help. There is so much information to digest, a lot, and it's humanly impossible for me to do it on top of trying to keep on current events, following all the briefings, because I want to be educated. I don't want to just come on here and without understanding what the government is doing, start bashing the government. That's why I feel strong to talk about the government and policies and how crazy and unreasonable they are, because I'm listening to politicians at all the three levels of the government, and to me it makes no sense. I'll make a simple example. Already Trudeau today saying that he said that, if in the future, this is probably, we might not need to do this again because it's not going to happen in the future. And he said it right after saying that this is the best thing that can happen because we will be prepared or something like that. I like not quoting it word for word, but you cannot have someone that says that this situation is something that's going to help us to prepare for the future. And then right away after he's saying that, it's not going to happen. How stupid you can be. What do you mean? We're not going to have more viruses next year or this coming flu season? You don't think this virus is going to mutate and going to come back again? Of course it will. And already you're talking about it's not going to happen again. And it did. This happened again in Canada. In just my life living in Canada, we had SARS and we had the swine flu. What do you mean it didn't happen before? What do you mean this is all a surprise to the government that the people are going to be locked down in a close proximity where the virus actually survives the longest and the strongest viruses in a closed environment with isolated people, risk population, long-term care homes, and prisons. And guess where the outbreaks are happening? They're not happening. The outbreaks are not happening with people walking outside. I'm not talking about making concerts and having parades, but I'm sorry, it's completely responsible for the government to force people to sit at home, because guess what? The immune system is getting suppressed on so many levels for so many Canadians that are sitting at home. And when people are jumping onto the comments and saying that I don't care about the people are dying, I care so much, and that's why I'm yelling on my Facebook, like, people are dying, and what are you people are doing? But at the same time, to me personally, it makes total sense, because the system in Canada is a sick care system. Guess what? Like, they need to have people who are sick, so then they have a system continue feeding into it. They need the people to fit into the sick system. If you have a healthcare system, you would advise people to eat fruits and vegetables, to up your vitamins and minerals intake. You would advise people to breathe the fresh air. You would advise people to quit smoking. Again, I haven't validated the research, but I think it's safe to believe, because I just quickly read the article, that smoking makes 14 times risk higher for you getting the virus and having severe effect to it. Not a single time all the three levels of the government even once mentioned that smoking is a high risk of contracting the virus. And one of my friends on Facebook early on in our debate in the week mentioned, well, it's very hard to make people quit smoking. You know what's very hard? Is to have 37 million people locked down at home. And guess what? We have it. You know what's very hard? Before they told us it would be very difficult to have a basic income in Canada. Well, guess what? We have a basic income in Canada right now. Now, am I against or for basic income? It's a whole other conversation. I am so glad that a lot of money going into the areas that were defunded in the last year at all the levels of the government, at the federal and provincial. Let's talk again about provincial. Ontario is a total joke. I shared today a briefing from yesterday. I shared on my page a link to a full briefing of Ontario government about current situation. And it's total disgrace. They say in the briefing, the Prime Minister, the Premier Doug Ford, and the Health Minister of Canada, they say in a briefing that in Ontario, they went out of controlling and managing care homes. Well, guess what? That's why we have the worst outbreaks there, because they're managed by private companies, okay? And they say it's very difficult, or we're not used to it. Like, it's total excuses, and they keep making them every day. Like, it's a total disgrace. If you so care about the health of Ontario, again, let's stick to Ontario, not the whole Canada, so I can keep the point straight. Like, people asking me, like, instead of just making complaints and arguing and scream and make some good points, what are the solutions? The solutions are straightforward. And actually, some journalists being very good at asking serious questions. Unfortunately, the politicians, what we do best is to dance out of it. Like, I make a comment before, like, I haven't seen so much dancing in my life as I've seen in the last 4 weeks watching everybody's, going away from answering the right questions. It's a joke. In Ontario, if you didn't know, guys, in Ontario, the long-term care homes are not managed by the government. And even once they declared the Emergency Act and whatever it's called in Ontario, and they decided to force people to stay home, and the outbreaks start happening 2 weeks after that in long-term care homes. Why couldn't you, on a day one, 4 weeks ago, 1 month ago, declare the state of emergency for the care home, the long-term care homes, and actually take charge of managing those people instead of having an outbreak 2 weeks after that? And then it took you another 2 weeks after that, people continue dying in long-term care homes because they're not properly taken care of, because it's a private organization, and they have multiple nurses working in the multiple locations, getting paid minimum wage, a total joke. And then 2 weeks after that, you pass a legislation, finally, that it will be mandatory for one person to work at the only single location. But guess what? Even that is still not implemented until next week. Like, what are you doing? Like, whoever has a phone to Doug Ford, please call him and tell him if you, and I can really have a compassion for Doug. Like, I can see the guy is stressed out of his life. And I feel for him, and I know he's doing his best. And you can only be as good as a leader as a team you have, okay? And of course, as a leadership is a whole other position. And again, I don't want to wear off too much of the topic, but he's surrounded by people that unfortunately not even doing a proper job. And again, I'll make a good example. The modeling was completely off. The modeling that he used to declare the current measures of people staying at home and all that other stuff, he implemented those measures only because he was showing that in Ontario, with people being locked down, we're still going to have 80,000 cases and 1,500 up to 3,000 people die. And of course, if I would be Prime Minister, Premier of Ontario, and I'm in charge of 14.5 million people, I would be scared out of my life. What do you mean? This is what's going to happen? Even once we lock people down, 100%, let's do it. So I understand him doing it initially, but it's been 1 month and that didn't happen. And people are going to say it didn't happen because of the lockdown, but I'm sorry. The people that were isolated were not protected properly, and the outbreak still happened there. Had nothing to do with having people that most likely didn't have a virus, or if it did, it was so symptomatic that it wasn't even happening. And you're forcing them to stay at home and suppressing their immune system, and they're actually getting sicker by sitting at home. To me, that's unacceptable. And so I discussed the World Health Organization. If you just joined me, you can watch it from the beginning. Once I finish it, I'll post it, guys. That the directives and the leadership of this country in terms of what we're supposed to do in the current situation is coming from World Health Organization. And the director of the World Health Organization is not a physician. He's a researcher. Okay, so but he's not a physician, so he's not a doctor. So I'm supposed to. If you tell me that I should listen to the doctors, well, maybe the person in charge of the World Health should be a doctor. So if he's not a doctor, maybe you shouldn't listen to him either. Number one, and then you have, and then the whole situation with them completely going one way and then the other way in terms of how serious this is. They allowed the virus to spread 100% into people, and some people recovered it better, some people have it now, and they're sitting at home, and the virus is developing. Do you know, guys, that people sitting home and they're calling? I'm actually start getting messages. Just again, a little side note to people that think that I'm crazy and completely lost my mind, and I'm only like, one of the few that actually question this situation. I'm actually getting messages now. I'm getting messages of support, and I really appreciate people taking the time saying thank you for doing what you're doing. I'm getting those messages now. I'm getting actual examples from people that think that actually they have the virus and they had pretty bad, time getting over it, and they actually called trying to request the test, and they didn't get it. So that's happening, right? But they forced them to sit at home, try to get better, then they actually would have been possibly better working outside, possibly in a mask, if they don't know if they have the virus or not, or being distant with other people so not to spread the virus. But they're forced to sit at home and not even getting tested and have no idea what's going on. To me, that's a joke, right? And if you're going to tell me again you were not prepared, you didn't know what was going to happen, I'm living in Canada for 20 years. This is the third time that we have similar situation going on. We had SARS and we had the swine flu. Okay, so don't tell me you didn't know, you were not prepared. It's a joke. I'm sorry. Total disgrace. And then when you're defunding, when you're not putting any money into the healthcare, the healthcare, not the sick care. Let's make a distinction. Okay, you don't have programs for people to be healthy. You don't have policies for people to quit smoking, because 14 times supposedly more chances for you to get in the virus and actually getting affected when you're a smoker. Like, why can't all the levels of the government create programs for people to quit smoking? Why not? Why that cannot be done? Like, besides this virus, people are dying from smoke-related disease anyway. 1 million people plus. Okay. Oh yeah, and this is the other thing that I wanted to share now that we're on this conversation. So the anyway, I'll leave something for the next. I don't want to go too long because I want to keep it relatively short so that people actually take an opportunity to watch this. So yeah, so I need your help, guys. I need your help. So whoever is watching this and you're actually curious about what's going on, number one, or you're actually aligned in some ways. I'm not even saying all the ways. I would rather have people that are not aligned with me 100% and they actually want to stay curious and they want to continue questioning the situation. Like, so if you're in either you're just curious about what's going on, you align on some of the ways of what I've been sharing this whole week, or you completely align with me. If you're any of those three people and you would like to help me manage a ton of information that's out there, trying to cipher through it and figure out different sources, different people, I'll make one very simple point. Again, I didn't make a note where I heard it, either at the federal government or provincial level, and I didn't know that. Again, there's so much to learn, and I want to learn for sure. There's 37 health public officers, the top in Canada. There's 37 different people. And it was said at one of the federal or provincial briefings that they actually have opposing views. Interesting. So I'm not the only one that actually have an opposing view. And I would really like to know which one and how many, and I'm sure it's more than one, out of the 37 top public health officers for Canada have a view that's similar to mine, or at least has some correlation to healthy living in the current situation, rather than all the focus is going at isolating the people that are sick and trying to help them to survive. And on that topic too, do you guys know that ventilators is actually not even that best case treating what's going on? And I'm not going to go into the whole conversation, but I won't be surprised that a lot of deaths that happened with people that were suffering from this virus is because even the procedures that the doctors was using, including ventilators, probably was not correct. And how can I make such a crazy statement? Well, again, the statistic in Canada is very sad that around 30,000 people die in Canada every year from mistakes made in hospital. That is a fact. You can go and check it. Okay, yes, the statistic is different from every year, but that's 20 times more than so far people died from COVID-19 in Canada. 20 times more from medical mistakes. Like, come on. I have, I think, a couple of nurses right now, they joined before on a call. I can tell you this, guys, that nurses a lot of times even more educated in terms of the healthcare and how best to take care of patients than the doctors are. And how can I make another crazy statement like that? Well, what I know to be true, and again, Google it, guys. Do you know that back in the day, there was a huge spread in infection in hospitals? And nobody couldn't really figure out why there's so much infection spread in hospitals. And then what happened is a nurse or a few nurses start raising the question that the doctors actually were not washing their hands as they're going between. I'm going to come back on a different life and I'm going to share this story in detail, but I think there was a lot of mothers were dying after giving birth to babies in the hospitals, and the public or whatever, the doctors couldn't figure out why you have after the delivery of the baby, the mother would die. And then what happened is that they actually realized the doctors were not properly washing their hands between treating people or even from work to delivering the babies. So it's actually the nurses that alarmed that the doctors were so out of touch with reality, what can cause the harm, that is because of the nurses, there's actual procedures now for the doctors to wash their hands and make sure that it's like, and that happened back in the day, I get it, but just again, another example that a doctor is just a person. A doctor is not a god, okay? A doctor is a simple person that went to school, got a degree, and most of the time, the only thing they know and hold to be true is what they learned when they were getting a degree. And think about this. They might have got the degree 10, 20, 30 years ago. And again, I don't know what certification renewal is required for the doctors on a yearly basis. For example, for the personal trainer to be certified every year, you have to continue taking the courses called continuing education, and then you can continue being certified. I don't know if that's happening for the doctor. I'm not going to question the doctor. Like, that's going to be very bad, I think, for me, right? But going back to, like, you're going to trust the doctor to tell you that it's 100% the truth, and the doctor got the knowledge 20, 30 years ago. Like, I'll make a very simple example on that conversation, that the old way of looking at things, that your genes determine what's going to happen to your life, is old education. A new education is that your environment will determine how your genes are activated, and that's going to determine your life in terms of what you might get sick of, what you might get exposed to, and how can you fight off different things that come your way in terms of viruses and diseases and anything else. So if majority of medical establishment is still treating the people blank, that whatever your genes are, if even they check that, a lot of people don't even think about, different genes can have different impact. They look at let's say all the population is 99% the same. Well, guess what? That 1% variation among humans create 7.7 billion different people. Even twins are different. Even from the same egg developed, twins are different. So you're going to tell me that you're going to have one blank approach one single vaccine and vaccinate over 7 billion people, and that's how you're going to get people healthy. It's a total joke. It's nonsense. The 1% variation in whole humanity makes us all so very different. So no, one vaccine is definitely not for all. And if you think different viruses, mutation, you're going to have 2-3 different vaccines, it's still a joke. Because again, if you look at a human body as a set variation, we're not a machine. Like, I know for Bill Gates, it's probably simple to think that, you know, if he created the Microsoft and operating system, and we all like computers, you can just load up one machine, one software for all the machines, that it's all gonna work. And if a few machines that crashes is not that big a deal, well, guess what? That's one life too many. People tell me one life too many in terms of people suffering from this. Why are you yelling for people to go outside? Well, because people are getting sick inside. That's why I'm yelling. It's been over a month, guys. We were told that this virus has a 14 days lifespan. Well, it's been over a month for us here in Ontario. I'm sorry, it just doesn't add up. Why do we need another 3 months or 2 months or whatever of a lockdown? It just doesn't make any sense. Oh boy. So again, guys, if you want to help me out, please send me private messages. I really appreciate all the likes and comments on the post, both that, you know, agree or disagree with me. It's totally fine. I said on my previous slide, I don't delete a single comment. I leave them all there. I personally am okay with people personally attacking me or my son or whatever. Like, again, if someone attacks me or my son, it says more about you than me. Like, it's all good. I take care of myself. I take care of my son the best way I know how. And he has a mom that takes care of him too. So like, he's good. But thank you for your concern. I really appreciate your concern. The other quick comment that I want to make before I forget, because I promised to one of the people, and I think it's important. I think it's a very important last point that I want to make. As a child, I actually spent a lot of my childhood in the hospitals. So I can talk from personal experience about what it is to be unhealthy. I'm not going to go through the whole list of different medical conditions that I had since birth. If it wasn't for my mom, that was always looking into natural ways of treating whatever I was going through, I probably wouldn't be here, 100%. Like, I know that. And then my dad, when they were together, like, they were taking me for all these different massages, like every day as I was newborn, to make sure that I don't end up to be a paraplegic or whatever. Like I'm forever grateful for all the efforts. And then being like 25 years old, I cannot even comprehend to be a 25-year-old person and managing a child who's unhealthy. Like, I can't comprehend that. So whoever is in a similar situation, I mean, it's my heart breaks for you guys. So, so I get it to be unhealthy, and spending months, like a ton of my childhood in a hospital for different conditions that I had is extremely tough, 100%. And that's why I am so loud talking about a healthy lifestyle, because thank God that I was able to meet a company that I'm personally been benefiting. I'm not going to mention any names, but whoever follows me, they know. Like, there's one company I've been a part of. Like, the first time I tried whatever nutritional products from the company, I was 8 years old. And that's why my connection to the company is so strong. Whatever you want to believe about the supplements, or specifically about that company, or the industry as a whole, it's totally your choice and prerogative, guys. But for me, I have such a strong personal connection because of the personal result. And when I came, and the first time, and so when I was a child, I would spend months in a hospital for different conditions I was going through. And I was actually excused from physical education class because of my health. Like, in Canada or whatever in the world, but in Soviet Union at the time, the physical education, like the physical education was where you actually would get grades and stuff, right? And I had a medical note to be excused from that class, So in my diploma, whatever, it's just not even there, or like it's just not applicable, the physical education in my diploma from my school, because I actually had like my medical book was thick as that. Like I'm not joking, not like if this is an iPhone, like it was probably as thick as this, with all the different conditions from my childhood, right? So when I came to Canada and I really embraced myself in a healthy lifestyle, and it's been 20 years of living and doing that, that's why I don't go to the hospital. That's why I don't even get OHIP card after 11 years first living here, and then only got it because I needed for the passport ID, and then it got expired, and then get another one until I needed to travel, and I wanted to make sure that I have travel insurance with my son, and I get to make sure that you have a valid OHIP card to get travel insurance. Those are the only reasons why I even got it. In Canada, I was in the hospital 3 times. 2 was, and in terms of actually doing stuff, like, I think I went to visit a few people here and there, but for personal reasons, I was in the hospital 3 times in my life in Canada of 20 plus years. 2 on a separate occasions, being involved in an accident, me on a bicycle and another car. One is I got fractured my finger, whatever, and that got messed up too, like a simple procedure, got whatever. And then the second time I had some injuries, but again, not luckily severe. And people joke around, I don't drink any milk, so my bones might be very weak, but when I got hit by a car, luckily I didn't break any bones. So that's just a side note there, right? You don't need to drink milk to get strong bones. There's supplements for that. So what I'm saying is that I have a personal understanding how it is to be unhealthy. And I have a personal understanding what it's like to live in a hospital. I lived in a hospital several times for months as a child. So I understand all that stuff. So, and I also understand what it is to live a healthy lifestyle, which I definitely practiced consistently for the last 20 years. And I'm grateful for the health and quality of life that I have at 40 years old to be able to keep up with people half my age. And I know this is going to continue, like it's not even the end. And again, I don't know, I might get hit by a bus tomorrow, and I'm not going to say too much about that because you attract what you talk about in life for sure. So people joke about me like, oh, you drink all your shakes and take all your vitamins. Like I take like 20 at a time, tablets, but that's my choice. But it works for my life for the last 20 years. So if you're doing something that's working for your life, keep that going. If what you're doing in your life creates the quality of life that you can really enjoy and you can do everything you want, do that 100%. Okay? So a little variations, so sidetracks possible. I apologize if I rumbled maybe on some of the points. It is a very emotional conversation and topic for sure. I can definitely see myself doing this going forward. I definitely can see that I need help just at the simple level even digest all the information that's out there. I understand a lot of people, what I was saying, like I get a lot of support from people and I appreciate and acknowledge. And I know 100% that a lot of people choose not to like or comment on my post because they don't want to get involved in some nastiness that's going on out there. And I get it. So if you're one of those people that you, like I said, I want to be curious, or you align on some of the things that I share, or you align on everything that I share, but you don't want to be at the front of sharing this information or try to influence people, but you want to participate in the influence that's definitely going to happen going forward. I'm not going to stop. I'm not going to give up, because for me, at this point, like it's if it takes individuals like me to talk about basic things like, eating your fruits and vegetables, taking your supplements, living a healthy lifestyle, breathing the fresh air and exercising, and quit smoking, okay? Rather than, stay at home and stay safe and whatever, and no mention at all about, quit the smoking, then maybe it's my responsibility to start doing that. Because the medical professionals that we're supposed to take advice about our health only talking about sickness. Okay, so I'm going to wrap this up. I've been going for, again, 45 minutes. Maybe that's more or less the time that's needed for me to do this. I try to keep it short, but maybe I don't have to keep it short. I'll just keep it as is. And whoever wants to watch the whole thing, please do. I appreciate the time that you can take. I know there's a ton of people you can listen to, and if you choose to spend 45 minutes to listen to what I talk about, that's great, and thank you. I encourage all the comments to this for sure. Don't have to be agreeing with me, but comment and give me feedback. I'll do my best to respond. If you find value in what I share in terms of information or even this live videos that are going to be going on, definitely forward. I appreciate the share. I think it's important for people to get alternative perspective. I think it's very wrong for the government now already openly talking about censorship and making sure people like myself don't actually voice concern about the measurements that I believe to be incorrect. And the measurements that are currently being taken actually hinder and damage the health of Canadians. I think it's a very important thing to do. So on this Sunday and Easter weekend, the short again is Ottawa, because I think we're going to make some moves for the people who's in Ottawa, making decisions for the whole Canadians. And you have to be a warrior and protector. And that's, you know, I'm going to be a voice for people that don't have a voice, and try to make an impact and influence people in a good way, in a positive way. You know, I want to focus on people recovering from this thing. I want to focus on people getting healthier. I want to focus on everybody getting back to regular life. I choose not to accept this as a new normal. Every time I hear any politician talking about this is a new normal, please, guys, do not accept that. This is not a new normal. We will not accept the new normal, okay? No, not unacceptable. Okay, guys? So I have like a whole list of things I'm going to be discussing going forward. I'm making different notes on when I have the conversations. I definitely want to have some people joining me. I was trying to have somebody to debate with yesterday. It didn't work out, but it's still going to happen either with that person or whoever wants to join. Participate, we can have discussions, we can have debates. It's definitely something that I'm going to be taking on. So we're going to wrap it up. I love you all. Stay healthy more than anything. And we'll talk soon. Love you all.